Good morning, ladies and gentlemen. First, let me say it's a privilege to be here amongst such distinguished minds. I've been to a lot of conferences over the years, but the minds of the people in this room far exceed mine. As stated previously, my wife Sue had motor neurone disease and finally passed away on Valentine's Day this year. Next, I'm going to add a disclaimer, which is probably unusual, but that's going to happen. I'm aware that our experiences are not indicative of the services that are provided and received by MND clients in Queensland and most likely Australia. I'll give you a brief overview of our life pre-MND. When I retired from the workforce in 2010, we both considered that we were reasonably fit and healthy and ready for a long retired life together of something like 20 odd years. I did not take any medication, and the only medication that Sue took was Oroxone for a thyroid she'd had removed in the 1970s, and calcium to make her bones strong, she thought. Following retirement, we toured Europe for the second time for 6 or 7 weeks, and then prepared to purchase a caravan to tour Australia. She was fit, and several times a week she'd walk 5 kilometres, just for the hell of it. During the Christmas period in 2010, our son, daughter-in-law and our 3 grandsons were with us for Christmas, and rain had caused some minor flooding in the creek between us and town. We decided to walk down to the creek, which is only a couple of kilometres away. Sue had trouble getting to the creek and was having severe difficulties with her left leg. We later worked out that her speech was also affected from about November 10, when she sometimes appeared drunk, even though we knew that she was totally sober. So they were the first signs that we had. Following the episode with the leg, we had visits to physiotherapists, our local Gympie doctor, Dr. Springall, Dr. Terry Coyne, who's a neurosurgeon in Brisbane, and Dr. Peter Patricios on the Sunshine Coast. In July 11, Dr. Patricios broke the devastating news that he believed Sue had motor neurone disease. Sue knew what it was, but I had no idea. Dr. Patricios suggested we should visit a Dr. Rob Henderson in Brisbane, who's a neurologist at the RBWH, who specialised in motor neurone disease. Dr. Rob confirmed the diagnosis on the 24th of November 11. Bearing in mind, we never kept a running diary, and some of the dates will be highly accurate and others will be generalised. In 2009, we'd built a brand new house on a rural residential circumstance 6 kilometres out of Kilkeven. Kilkeven, for those of you who don't know, is a little country town of about 500 people, 3 hours northwest of Brisbane and half an hour west of Gympie. The only modification that was required to this house was to build a ramp so that Sue's wheelchair could get into the house. We were asked by many people, did we build the house with this in mind? I can rest assure you, when we built the house, we had no idea the path we were going to go. Throughout the whole process, I endeavoured to be prepared for whatever comes next. And as you know, for the uninitiated, this is trying and difficult. A basic walking stick was first, then a 4-prong walking stick were the early bits as we then progressed onto a wheelie walker. The process of putting Sue's shoes on became very difficult. And in the junk mail one day we received a brochure detailing orthotic shoes. So we got ourselves off to the chemist in Gympie, and it wasn't the one that we normally attended, and found Velcro shoes in several colours. Because as most of you ladies will know, one pair of shoes is not enough. We purchased an electric reclining lounge chair that also assisted her to stand from the chair, and she continued to use that right until the end. And I think you'll see a photo of her in that. The first pieces of significant equipment we acquired was the wheelie walker and a static toilet chair from a friend in Kilkeven, bearing in mind that we were the first person in this little town to actually have motor neurone disease. And in a previous life, I'd championed the establishment of a multi-purpose community health centre to service our old shire. As part of this service, my employer had purchased aids for elderly and disabled people. From there, I was able to get a hold of a shower seat and a push wheelchair. This basic equipment was in fact sufficient for us in the early stages. There were also many other small pieces of equipment that we trialled and used along the way, too numerous to mention. In the early stages, Sue kept her independence and her ability to continue in her voluntary work at our local museum, where she volunteered up to 5 days a week. She continued to drive her car, her Celica, for as long as she could, bearing in mind that the left leg was the first affected. So as you know, a manual car is difficult to operate. We changed cars and purchased an Audi where everything was automatic, and she was able to continue driving for quite some time. Later we purchased a little Renault wagon that was converted to carry a wheelchair. Following the diagnosis by Dr. Rob, we continued to attend his MND clinics at the Royal Brisbane Hospital, and we continued to attend these clinics as suggested, and during one of these clinics it was suggested that Sue needed to have a PEG. I presume you all know what a PEG is, better than I did before that time, in preparation for when she was not able to feed herself. We elected to have this operation at Prince Charles instead of having it at a closer hospital, which was also an option. I believe that this decision was more beneficial than we originally thought, as it introduced us to Dr. James Douglas, the Director of Sleep Disorders, and his team at Prince Charles. In September 12, we were also introduced to a VPAP machine. In November 13, we progressed to a second VPAP machine, as Sue was regularly using the original machine for more than 12 hours a day, and that's not very comfortable. She had her original PEG inserted in October 12, and even though we did not have to use it for nourishment for quite some time, even though this PEG was supposed to have a life of only 12 months, it was discovered after 13 months that she still had it, and it was replaced in a day clinic in Nambour Hospital in November 13. This replacement procedure was organised by Dr. Welch on 2 days' notice. We were very fortunate. Shortly after the original PEG was inserted, travel became much more difficult, and we elected to attend clinics at Prince Charles rather than at the Royal Brisbane. But even there, we were still treated with a full range of specialists, including Dr. Rob and James Douglas. We continued to attend these clinics for as long as possible, and then the Prince Charles organised for these clinics to be conducted via video links to our local hospital in Gympie, which therefore meant we didn't need to travel. By changing the location of our clinics, though, we were no longer able to participate in the research being carried out by Dr. Rob and his colleagues. This was disappointing, but Sue's health was of primary importance. During an early visit to Dr. Rob's clinic, it was suggested that we might like to use an iPad with an application called Prolo 2 to Go. At that stage, we didn't have an iPad and had no idea what the software was. This application actually speaks after the user types what they wish to say. We purchased these so Sue could be accustomed to them before she really needed to use them. And she continued to use the iPad and Prolo to Go to the end as well. Towards the end of 2012, I applied to Centrelink for a disability allowance for Sue, and some months later, a friend who knew more about Centrelink than I did at that stage told me that any funds we had in superannuation was not considered an asset by Centrelink until we reached the age of 65, and I'm not quite there yet. We subsequently completed the 108 pages in order to apply for a disability pension for Sue and a carer payment for myself. These applications were subsequently approved. This is very relevant, as much of the assistance we received was because Sue was in receipt of Centrelink benefits. One of our earlier visits to Dr. Rob He also referred Sue to the community health services at the Gympie Hospital, as did our local GP. Even though the allied health staff at Gympie had a level of turnover, each one of them was most helpful and very professional. The OT and physio would be available at their facility or would come to our house, which, bearing in mind, is 50 kilometres away from their facility. Owing to the professionalism of these ladies and the fact that Sue was receiving benefits, they made applications to Queensland Government's Medical Aids Assistance Scheme, or MAS as we know it, for the necessary aids. These included a shower and a toilet chair, which are on wheels, Roho cushion, motorised wheelchair, and an electric hoist and slings. As an aside, the toilet chair and shower chair, as you know, sort of stands about so high. I went to our post office one day and the lady in the post office said, "Did I have a utility?" Because this chair had come by Australia Post. I thought it was most unusual, so I was able to get it without any problem though. Without these aids, I do not know how we would have managed. It was not just getting the aids, but getting the right ones at the right time to fit the actual patient. We were in contact with the speechie at the Gympie Hospital from a very early process to provide advice on Sue's ability to swallow and to communicate, and we continued to have contact with her either in person or by phone right until the end. We visited the dietitian at the Gympie Community Health Centre from shortly after Sue's PEG was inserted. As the PEG was inserted early, we did not originally need those services until it became too difficult for her to take nutrition orally. The dietitian was in contact with us regularly. During this time, we changed from bolus feeds to delivery through a pump. The pump was loaned to us by the company from which we purchased the feeds, and this was all arranged by the dietitian, and the feeds that we'd used were actually subsidised by the state government. On Mother's Day 12, I think that's when it was, we were having lunch at our favoured restaurant in Gympie, when by chance the wife of the owner, who was also a nurse, told us that we should be a client of Little Haven Palliative Care Centre in Gympie. She suggested we might use their services. And during the last 12 months or so, the nurses from Little Haven visited our house, originally fortnightly, weekly, and eventually twice a week. And without them, we wouldn't have survived. And as MND progressed, the nurses were concerned that bed sores would become an issue, so Little Haven provided us with a hospital bed and air mattress. At this time, we removed our queen-size bed to another bedroom, brought in the hospital bed and a single bed for me. The single bed was to allow me to continue to sleep beside her, to monitor her all night. Little Haven also provided many other items, including an electric sucker, which thankfully we never had to use. On the last Wednesday of each month, we visited the stoma nurse at Gympie in relation to making certain her weight was correct and the PEG was working properly. By doing this, we were able to monitor her weight right through the whole process, and luckily she didn't lose any weight. Dr. Henderson also referred us to Dr. Louise Welch at the Gympie Hospital. She's a palliative care physician and director of palliative care. Originally, we visited Dr. Welch fortnightly, but as time went on, that changed to weekly. And when it was too difficult for us to travel to Gympie, Dr. Welch would phone us when she visited her weekly clinics to provide the necessary advice. And our friends in Kilkeevan would often comment that Sue was being micromanaged by her carer. And with the help of the many health professionals, we were able to be prepared for her for this disease. Two of Sue's friends would regularly come to our house, massage her feet and hands, and one of those ladies also painted her fingernails, which she didn't do much in her own life. The townspeople would inquire on a regular basis when I went into town to collect mail, etc. But only a few ever visited our house, And this was mainly to preserve her dignity, because the last thing an MND patient needs is people wandering in and out. I believe it's most important to maintain dignity, particularly when speech has gone and bowels are not fully controllable. Thank goodness that our lounge room had a tiled floor and very easy to clean. Even though we joined MNDAQ soon after Sue was diagnosed, we did not use their services, as we were able to satisfy our needs locally or with the help of local professionals. My life as a carer came to an end at 7:30 on Valentine's Day this year, but it was not the end of the day. I made the necessary phone calls to family, friends and to Little Haven. In less than half an hour, friends arrived to check up on my well-being and stayed all day until my son arrived later in the afternoon. The palliative care nurse did the necessary paperwork, advised the doctor and the undertaker. I had made preliminary arrangements with the undertaker earlier in the week. People just seemed to be coming and going all day. Well wishes and even bringing food. It was an honour and a privilege to call this woman my wife and partner. Furthermore, we were privileged to be serviced by such a professional team of health professionals from the very beginning until the very end. There's a couple of dot points I've written here that I think are relevant from all points of view. And not everyone gets this one, but I think it's important. If you're in receipt of Centrelink benefits, particularly in this state, it has a significant bearing. Love and affection to maintain dignity all the way through is of most importance. The professional and support of health professionals, which we were lucky to have right through. A house suitable for a disabled person, and a full-time loving carer. Thank you.